I think there's a huge opportunity around digital healthcare and for both our NHS and social care services, and how we can actually make that happen, I think, is what's most important to all of us as politicians in Parliament and working with the sector to actually realise that potential. Since I was elected, I've been amazed by the number of pilot projects going on in our NHS and social care services. There seems to also be a blockage in the system where we have pilots across our country, but then they don't really get rolled out. So I want to see that happen. I think most politicians across the whole chamber want to see that happening, but it's how we actually try to work towards a number of areas which are holding us back.
I believe that technology is a force for good, but I also think there's some constraints, and I would emphasise this. I think it's really important that patient data security is absolute paramount. I think we need to be very careful with that. And I suppose the other side of that coin is that the use of patient data can also be a fantastic planning tool to protect individual episodes in patients' lives, but also larger scale data can be used to predict health trends. So I'm conscious there's a conflict in these two statements. One is about security, one's about planning. But there is absolutely no doubt to me that we can revolutionise our healthcare by the use of much smarter systems. One of the wider issues is that we have a huge feast of data around patients. To what extent can we use that information to plan our services in the future? I do think we're missing some tricks on planning. Technology has made a great leap forward in our normal lives. Are we using enough of this within the NHS? Are we sharing enough?
The heart of a lot of this is the interconnectability and interoperability of technology across Scotland, because one of the aspects which was raised with us was sometimes we can't actually communicate between health boards to actually spread that information. So there's a real issue how we have to tackle that, how we have to have a single platform or a spine across our health technology in Scotland. So these issues we highlighted and wanted to see the government progress, because it's quite clear that there's opportunities for the comorbidity issues we have in Scotland for patients to have that access and to have that from home to prevent travelling. So I think where we saw the e-health in the past really move out, we need to actually see the next generation now come forward to try to make that happen. And a lot of our European neighbours are already seeing technology being taken up where we're not. So we've got a lot of catching up to do, but we've got a great opportunity as well to lead the world on this. The opportunities to improve our health and well-being are just enormous, and we should really look towards the exciting opportunities in the future that technology offers.